Every day, as you express joy with a smile or surprise and stress with a frown, your facial muscles contract. Over time, this leads to the development of wrinkles that gradually become more pronounced. It's a concern not just for women, but for men too, as these are telltale signs of aging. To fend off these expression lines, it's crucial to start early, before they become permanent fixtures on your face. Remember, it's much easier to prevent wrinkles than to erase them. It's important to note that it's never too late to benefit from Botox, even if static wrinkles have started to appear, provided they are not too severe. Smoothing out facial wrinkles and fine lines, like laugh lines, crow's feet, and frown lines, is the primary FDA-approved use of Botox injections. Let me share the story of a patient of mine, Adam. In his early 40s, Adam was troubled by moderate horizontal forehead lines. Like many, he thought it might be too late for him to see any real benefits from Botox. In my view, Adam was an ideal candidate for the treatment. Just 2 weeks after his injections, there was a noticeable softening of his forehead wrinkles. Moreover, ongoing Botox treatments can effectively prevent further wrinkles. Many people know that Botox, or botulinum toxin, is used to smooth existing wrinkles for a more youthful appearance. However, some also praise it as a preventative treatment, starting injections before any fine lines even appear. But does Botox genuinely prevent wrinkles from forming? How does it do that? And should you consider having Botox as a preventative treatment? Firstly, let us discuss how does Botox work. Botox is a trade name for botulinum toxin, a neurotoxic protein that, when injected, temporarily paralyzes muscles. This paralysis allows the skin above to smooth out, making it a popular choice for combating wrinkles in the cosmetic industry. So, should you consider preventative Botox? The decision to use preventative Botox depends on an individual's natural facial expressions. I never adopt a one-size-fits-all approach. For example, some might frown frequently due to wearing glasses or not wearing them when needed, and this can start affecting their appearance as early as their late 20s. If such expressions begin to create permanent lines, I would suggest considering Botox to prevent further lines from forming. With over 15 years of experience with Botox, I have a straightforward method to check if preventative treatment is needed. I stretch the area with my fingers to see if a line remains. If it does, I discuss with my patient the possibility of using Botox to gently relax the muscles and prevent deterioration. We often talk about areas like the vertical lines between the brows and horizontal lines across the forehead. Leaving these untreated could make the wrinkles worsen and become harder to treat later. Typically, less Botox is required to achieve the desired effect, and treatments can be spaced further apart. In experienced hands, this subtle approach should be virtually undetectable. Take Adam, for example. The Botox treatment he received 4 months ago has softened his forehead wrinkles by 90%. If he continues with treatments every 4 to 6 months, these wrinkles may never fully develop, possibly until much later in his life. Why opt for regular and consistent treatments? Consider a piece of paper. Once crumpled into a ball, it's much harder to smooth out than if it were only lightly creased. This analogy fits well with preventative Botox, which should be tailored to each individual, considering the right timing for their skin and facial features. My practice philosophy remains simple. Still you, just better.